Hello, my name is Dr. Cagnes, board certified OBGYN, streaming from the beautiful Cape Cod, Massachusetts. Welcome to my YouTube channel about HPV infection. Today we're going to talk about accuracy of pap smears. Pap smear is a screening tool that allows the early diagnosis of abnormality of the cervix and the reproductive tract, analyzing the cells coming from the cervix and the cervical canal. Screening and secondary prevention are extremely important in fighting HPV infection and decreasing the incidence of cervical cancer. Studies show the screening for cervical cancer reduces the mortality by 40 to 50%. Pap smear is a screening test, but it's not, unfortunately, 100% accurate. In fact, it does have false negative rates up to 43.2%. This means that the pap smear may be completely normal, but is falsely normal because it failed to detect an abnormality that is already existent at the level of the cervix. On top of that, we are only screening for less than 10% of the high-risk HPV. In fact, the tests commonly available are good for only 14 of the HPV, where we have at least 200 different strains of high-risk HPV present. So this means that even the HPV test can be negative, not because a patient does not have HPV, but because failed to test every single high-risk HPV that can affect our body. There are other factors that can affect also the accuracy of the pap smear. For instance, it's extremely important to have a good quality of sample that the provider will send to the cytology lab in order to have an accurate pap smear. The sample may be too small and not representative of the real situation at the level of the cervix. There may not be enough cells coming from endocervical canal. This is a very common problem when obtaining pap smear. Sometimes the provider does not get enough endocervical cells. There are two different portions of the cervix that we test with the pap smear. One is called ectocervix, so it's the outside portion of the cervix that sticks inside the vaginal canal. But the second important component is the endocervical component. Is basically testing the cells that are deeply located inside the cervix. If the endocervical component is missing, the pap smear is not satisfactory, meaning that it might actually completely miss an important abnormality that can be deeply located inside the cervical canal. Unfortunately, older women are more prone to unsatisfactory pap smear. With the age, the menopause, the changes at the level of the tissue of the vagina and the cervix, the opening for the cervical canal can be extremely narrow, sometimes is totally obliterated, preventing the provider from obtaining a good sample from the endocervical canal. So older women are more at risk for less satisfactory pap smear. Therefore, they should be checked annually because the likelihood that may be an abnormality hidden inside the cervix that has not been revealed by the pap smear. Sometimes the sample is contaminated with blood, and therefore they reduce the accuracy of the pap smear because it might obscure the presence of abnormal cells. This problem is less prominent with a new technique that we use is called team prep, where we basically rinse the sample obtained from the cervix in a special solution instead of smearing on the glass like traditionally was done in the past. With a thin prep, we reduce the effect of obscuring the sample with blood, vaginal secretion of foreign substance that may be present in the vaginal canal. But it may be still a problem. Sometimes we have to bring the patient back to repeat the pap smear because has been contaminated with too much blood. The HPV testing is extremely important in adding accuracy to the pap smear. You can have a pap smear by itself, where basically you provide the lab with a sample of cells and mucus from the cervix. But because the pap smear is not very accurate, adding also HPV testing will increase the likelihood to detect abnormality of the cervix. The presence of HPV, and we are talking about high-risk HPV only, is a game changer because it increases the risk of the patient to develop cancer over the years. So it's extremely important to add the HPV testing to the yearly pap smear. Please let me know if you have any question about this important topic. You can find me at my website www.yourhpvmdcoach.com. Please stay tuned and I'll talk to you soon. Thank you very much.